Hello guys and welcome to this review section. We are looking at the course outline of NUR 332 Medical Surgical Nursing 3. It's a 3-unit course. So welcome and let's go through it together. Okay? Fine. This is a service course. These are service students, grading students who are already practicing. So for you to be taken through this course, you need to have covered medical surgical 2. Okay, medical surgical nursing 2 is a prerequisite for this course. Okay, so the purpose of this course, that is it. This course is designed to enable the student to apply knowledge, skills, and the appropriate attitude in the management of integumentary stroke skin disorders, urinary disorders, and neurological system disorders. So the course involves both theory and practical sessions. What are the expected outcomes? Well, we expect you at the end of this trimester you need to be able to describe common medical and surgical conditions that affects the system we have covered. We have already mentioned the integumentary system, the urinary system, and the neurological system. You need also to apply the nursing process in the management of integumentary, urinary, neurological disorders. And lastly, you need to describe common geriatric conditions, some of which they are touching on these systems that we have already listed. Let's look at the course content. It's saying during the first 1 to 2 week, we are going to be concentrating on neurological or urinary disorders. This will include renal disorders like glomerulonephritis, pyelonephritis, hydronephrosis, nephrotic syndrome, nephrosclerosis, renal failure, disorders of the urinary tract, ureterocalcilis or calcalis, or the stones, yeah? We also have the urinary tract obstruction, urethritis, cancer of the bladder, okay? Guys, cancer of the bladder normally presents with a painless hematuria, right? Yes, we'll also be looking at it in detail. So next will be followed by week 3 to 4, and week 3 to 4 we'll be concentrating on male reproductive system. And the male reproductive system, you know how important it is? Yes, yes. So the disorder, will be looking at the disorders of sexual function, look at the infection of the penis and the urethra, disorders of the scrotum. Yeah, yes. So the scrotum, normally it should appear like an egg, right? Great. So, and then you have the disorders of the testes, adjacent tissues, disorders of the prostate gland. Yeah. Remember, this is where we are going to have the BPH, yeah? BPH, benign prostatic hyperplasia, right? Great. Then you have diagnostic and therapeutic disorder procedures like cystoscopy, intravenous pelography, catheterization, urinary diversions, prostate levels, Yes, mention them. Even digital rectal exam, yeah, we'll also be seeing how it's applied here. Okay, so after we are done with that, we'll be looking at neurological disorders. And neurological disorders, this will come in week 5 to 8. Okay, so in these neurological disorders, you're interested in the headache, altered level of consciousness, inflammatory disorders like meningitis, encephalitis, degenerative disorders like multiple sclerosis and Guillain-Barré syndrome, guys. Can you take some time and get the 5 differences between multiple sclerosis and Guillain-Barré syndrome? Make sure you tabulate. make a table, okay? Tabulate, okay? Great, tabulate. Apart from those two, we also have Parkinsonism, Alzheimer's disease, we have traumatic disorders, prolapsed intravertebral disc, spinal cord injuries, head injury, tumors, cerebrovascular disorders, cerebral aneurysm, cerebrovascular accident, yeah, the stroke, guys, yeah, is the stroke. So we'll have to review the stroke, yeah, stroke, guys. Then you have the lumbago, yes, cranial nerve disorders, diagnostic tests and therapeutic procedures in the nervous system. For example, the intracranial surgery, cerebral angiography, myelography, transcranial Doppler, yeah, EEG, MRI, computed tomography, lumbar punctures, yeah. All these we are going to be looking at. Of importance for the nurse is to give the nursing intervention for a patient undergoing all these tests, yes, and if there's any assessment you need to do. We also be looking at skin disorders, okay? Integumentary system disorders, looking at infection, infestation, acne, dermatitis, psoriasis, pemphigus, tumors, burns, skin procedures, plastic reconstructive surgery, skin tests. And lastly, the topic of our interest will be geriatric nursing. We want to define nursing, what geriatric nursing is, identify the nursing care of the elderly, explain theories of aging. Yes, guys, you should be having at least 5 theories of aging. Should be able to list age-related changes, also list the mental health problems in elderly, health issues of the elderly, ethical legal issues affecting the elderly, programs on aging population, role of the government in taking care of the elderly or the aged, community services and nursing homes, and advocacy role of the nurse on geriatric issues. And lastly, want you to be able to at least diagnose abuse, okay? List signs of abuse in the elderly, okay? Supposing you encounter or you come across an elder or an aged guy, are you able to tell whether he's being abused or not? That is the biggest question. We anticipate to visit any geriatric home. Yeah, we pray that it should be accessible for us to be able at least to apply or see how these concepts are being applied in the community. Then lastly, we're going to have the end term exam. The mode of presentation will be both physical and online, asynchronous and synchronous. Asynchronous, I'm going to be sharing videos, YouTube channels where you are going to be able to go through them, okay, at your own time, at your own pace, okay, getting to understand all the concepts. Synchronous will also be having online virtual and also physical face-to-face sessions. So we are going to cover all the synchronous and asynchronous. Class discussion, class case studies, multiple media, group activities, guided demonstrations, simulations, all are going to fall either in the synchronous or asynchronous mode of teaching. Okay, thank you. We're going to look at the CAT assessment. And in the CAT assessment, in the course assessment, you're saying you have the CAT, which constitutes of 50%. Then you have main exam, which consists of 100, but will be converted back to 50. So that you take the 50 in the CAT plus the 50 in the main exam, giving a cumulative figure of 100. Okay? Thank you. So the weighting between the theory and the practice will be as follows. Theory exam is 50, clinical assessment is 50, totaling to 100 marks. Co-reading books are as the following. Yeah. In addition to this, I'll be sharing YouTube links to show you what I really want you to be focusing, and the journals where you are able to update yourself and make yourself a better professional nurse. These are some of the journals that you're going to be looking at. Yes, American Advanced Medical Surgical Nursing. Yes, we'll be really looking at this one, okay? Because we want to measure ourselves against the best. So guys, I hope this course is going to be an enjoyable session for all of us. So I encourage you to be free. Just be free as much as you can so that all of us can be able to learn from each other. Okay? Anything, any criticism, anything new is welcomed in the discussion so long as we make it better for all of us. Okay? Until next time, goodbye from me. Bye.